you're late. So we were talking about proximal versus distal. So proximal, I think of that as towards the center of the body, and distal as away. So for example, a popular use of the word is for the phalanges, right? So this is the proximal phalange and this is the distal phalange. This is the proximal phalange, the intermediate phalange, I think. I'll have to look that up, and then the distal phalange. This is for the tibia, This is the distal end, and this is the proximal end. Same for the fibula. For the fibula, this is the proximal end of the fibula, and then the distal end of the fibula. But relative to each other, the kneecap, for example, is proximal to the tibia, but the kneecap is distal relative to the femur. Femur, patella is distal. For the tibia, the patella is proximal. Okay, now the bones of the foot, very important. We'll go over this over and over. We'll go over the bones of the foot over and over and over again, because there's quite a few of them. You have the calcaneus, which forms the Achilles tendon, and then you have the talus. So the talus receives most of the weight from the body. If you look at the tibia, very, very, very thick bone. If you look at the tibia, you can see it sits on top of the talus. You can't really see the calcaneus from this front view because the calcaneus is a little bit too posterior. So the tibia sits on top of the talus. Talus sits on top of the calcaneus and also pushes against this navicular bone. Here's the navicular bone, navicular bone, navicular bone. And the navicular is one of the 5 tarsals, 1, 2, 3, 4, 5. Of those bones, I only know the names of 2. That's the navicular and the cuboid. And then there are 5 metatarsals, and then there are 5 digits, each with a number of phalanges. Larissa, what is the difference between the number of phalanges in the big toe and the number of phalanges in each of the other 4 toes? What is the difference between the number of phalanges in the big toe and the number of phalanges in each of the other 4 toes?
I forgot.
The difference is 1. So the big toe has 2 phalanges, and each of the other toes has 1, 2, 3 phalanges. This is a better drawing over here, because they made the distal phalanges really, really small on the other drawing. So there's that word distal, right? Distal and proximal. See, distal and proximal, distal and proximal. So the big toe, I'm sorry, let me back up. Here's the tarsals. There's this cluster of 5 tarsals. And then here's 5 metatarsals. It's the long bones of the midfoot. And then there's the toe. So here's 1, 2 phalanges in the great toe. It's also called the hallux. That's why the muscles on the side that have tendons under the big toe are called flexor hallucis brevis, flexor hallucis longus, because it attaches to the hallux. You'll be able to listen to all this again on the video and watch it on the video. And then there's 2 phalanges in the hallux, 2 phalanges in the great toe, and then 1, 2, 3 phalanges in each of the other 4 toes. Same for the hand. 2 phalanges in the thumb, and then 1, 2, 3 phalanges in each of the fingers. Good. Charday, you're nodding your head like you feel like you really got it. Feel like you really got a solid grasp of the bones of the foot and the toes?
Yeah. Yeah, like
Good. I'm glad to hear it.
the one versus the two, and all of that. Yeah.
Good, good. I like it when people get stuff. Allows us to put it away. Okay, so now we've looked at the bones of the leg from the femur down through the toes. We've looked at which side is proximal, distal, which side is lateral, medial. We've looked at the muscles that are on the side of the surface, and we looked at the difference between inversion and eversion. So now if we go back to the question, hopefully you feel like armed with all that information and really thoroughly oriented. I want you to start using that word, oriented, to what side or what part of the body you're looking at if there is an inversion. There's an inversion, right? You're looking at what side of the lower leg. You're looking at the outside, the lateral side. So you look for, if it's what muscles will be lengthened, you look for the muscles that are on the lateral side of the lower leg. Not the gastroc, not the tibialis, not the plantaris. Yes, Marcos.
So yeah, it is the fibularis, right? The longest brevis, and it's the first one.
Exactly, fibularis, longus brevis, aka the peroneus longus brevis,
And
the
it is a
extensor
little,
digitorum.
and it is a little confusing because I mean but then again, the tibialis, it is an inversion, an inverter, right? Of the ankle, or no, that muscle.
Which one is an inverter? Which muscle?
The tibialis.
The tibialis is
Posterior.
a dorsiflexor.
Okay.
It's a foot extensor. Right?
Okay.
Okay. But what you really should be thinking is, what surface of the leg, what surface of the lower leg is the tibialis posterior? Oh, no, wait, I'm sorry. I was thinking tibialis anterior. Tibialis posterior is a plantar flexor. It's a plantar flexor.
Okay.
But it's not going to be lengthened as an overstretched when you invert the ankle. Furthermore, when you invert the ankle, there's also an aspect of what? Supination or pronation. I'm sorry, dorsiflexion or plantar flexion.
Yeah, the tibialis posterior is plantar flexion, right?
Tibialis posterior does plantar flexion, so does the flexor digitorum longus. However, if you, I want you to think about the surface of the leg. They're asking about an inversion which goes this way. So try to remember the diagram and look at your own foot and go like this. Do you see plantar flexion or dorsal flexion? Plantar flexion or dorsal flexion?
I see dorsiflexion, right? Or
unfortunately it's plantar flexion.
Okay.
Plantar flexion. Okay. Pick your own foot up and do that inversion movement and feel how those muscles in the back of the leg, feel how the tibialis posterior and the soleus and the gastroc are contracting. Feel those contracting?
Yeah, I do.
Okay. Can a muscle contract and be lengthened at the same time?
No.
There you go. I mean, hopefully. Do you understand?
Yeah. I mean, one thing that I do have to do is definitely go over my muscles.
Well, we're going to do quite a lot of that. We're going to do quite a lot of that.
Perfect.
Okay. Every time we mention a muscle, if you don't know where it is, just say, I don't know where that is.
Okay.
Of the following physiological effects, which is a reflexive effect for jostling and shaving? Okay, great. We'll come back to this in a minute. So let's take a look at the difference between for massage techniques, the difference between reflexive and I'm now forgetting my terminology. Mechanical effects. Okay. The effects of massage can be considered to be composed of mechanical or direct effects and reflexive or indirect effects. Mechanical effects are those that are directly caused by the massage application or the massage hand technique. reflexive effects occur indirectly via the nervous system. So mechanical effects are what the technique does to the body, and reflexive effects are what the body does as a result of the techniques. So a mechanical effect for jostling and shaking would be what happens right away as a result of jostling or shaking. A reflexive effect, which is what they're asking about here, would be the body's reaction to the jostling and shaking. And that may happen a few seconds later, or it may happen the next day. So you have to know for jostling and shaking what the mechanical and the reflexive techniques are, or effects are, and we'll go over those two little by little. So which do you think it is? Do you think it's temporary ischemia? Do you think it's a decrease in muscle guarding or tonicity? Loosening the muscles in the thoracic cavity? Do you think it's stimulating the synovial activity? Which do you guys think it is? Anyone, unmute yourself and call out.
Decreases muscle guarding and or tonicity.
Okay. Josh, what do you think?
That was going to be my guess, but I don't know for sure.
Okay. Larissa, was that going to be your guess?
No, I was gonna say loosen mucus.
Loosens mucus. Okay. There's only one technique that loosens mucus in the thoracic cavity. It's a percussive. It's one of the
Tapotement.
few percussive techniques that we use. Tapotement. Yeah, exactly.
Tapotement.
Exactly.
Okay.
Yep. And I believe that would that be a mechanical, like a direct effect, or would it be a reflexive effect? Loosening mucus in the thoracic cavity as a result of tapotement. Just guess so you have a concept. We'll see it later.
Oh, wait, say it again. I'm sorry.
Just take a guess whether tapotement, loosening mucus in the thoracic cavity, would be direct, like mechanical, or reflexive.
Direct.
I think so too. Yeah, I'm sure we're going to see it. Okay, so we think it's decreasing muscle guarding or tonicity. Let's take a look. And the nice thing about these questions is that they list the mechanical and the direct effects. So jostling or shaking's mechanical effects include stimulating synovial activity when applied over the sacrum. The reflexive effects include stimulating or relaxing the muscles depending on the depth and rhythm, decreasing muscle guarding or tonicity, and hyperemia, which is secondary to ischemia. So from this, let's look for a moment at the difference between the definition of ischemia and hyperemia. Hyperemia. Can you guys just tell me what is the difference between ischemia and hyperemia? Anybody? Okay, let's look at our prefixes, right? So ischemia, I don't know what the actual prefix is on that. Is it I? Is it IS? I don't know. But hyperemia, I know for sure the prefix on that is hyper, so too much, right? And then emia, I'm going to guess that has something to do with blood flow. So, or maybe movement of fluids or something. So I'm guessing that hyperemia probably means too much blood or like a lot of blood. So hyperemia occurs when excess blood builds up inside the vascular system. Hyperemia occurs when excess blood builds up inside the vascular system. Whereas ischemia maybe I missed it. Oh, okay. Ischemia, an inadequate blood supply to an organ or part of the body, especially the heart muscles. Ischemia, an inadequate blood supply to an organ or part of the body. Inadequate blood supply, hyperemia, excess blood. Charday, did you have those definitions like really solid?
No, I definitely wrote them down.
Oh, okay, okay, all right. I'm trying to get an idea of what you guys know, so I'll be asking you guys stuff like that. Okay. Hyperemia and ischemia. Let's take a look at, well, let's just keep going. It's okay. So the role of a sports massage therapist is to diagnose and treat sports injuries, treat only soft tissues, work with the team of athletic care providers in providing event and treatment massage, provide positive support and encouragement with good music. Sports massage therapist, diagnose and treat sports injuries, treat only soft tissues, work with the team of athletic care providers in providing event and treatment massage, provide positive support and encouragement with good music. So which one sounds like it might be questionable scope of practice?
You said it might be questionable.
Might be questionable scope of practice, like might be out of the scope of practice as a massage
The
therapist.
first one, the diagnose and treat sports injuries.
And why? Why is that?
Because that's above what we do as far as diagnosing. And
Yeah. Yeah, we don't diagnose. Acupuncturist, I'm an acupuncturist, licensed acupuncturist, but I do a ton of body work, a ton of massage. I'm not allowed to call it massage because that's not my scope, but I've studied a lot of Tuina, a lot of shiatsu, a lot of joint mobilizations. It's funny, they take old medicine and they tell us what we can do with it, but that's another story for a different class. So anyhow, diagnosis, yeah, we're not allowed to diagnose, but we are allowed to treat sports injuries, right? And then treating only soft tissue injuries, a lot of things happen to athletes. You know, they have nerve tears, they have bone level injuries. Positive support, yeah. Encouragement with good music. If I were to take that answer seriously, I would say, well, I think every provider would do that. That's not unique to a sports massage therapist. But working with a team of athletic care providers and providing event and treatment massage, yeah, that's not the only thing that they would do. But it doesn't say work, you know, only work with the team, right? So it should be that one. Okay, the blank act addresses the use and disclosure of an individual's health information, the rights granted to individuals, and breach notification requirements. There should be only one possible answer in your mind, and that's the Health Information Portability Act of, I don't know, I forget what the additional A stands for. Attorneys. What bone is the second strongest in the body following the femur? Everybody touch your femur for a sec. You know where your femur is, right below your hip. So it makes sense that that'd be the strongest bone in the body, right? But look at the list of the bones. Think about the width of each bone, thickness of each bone. What do you guys think? Anybody? Fibula, humerus, tibia?
I would say
ligaments?
tibia.
Yeah.
Tibia?
So tibia.
Probably.
Yeah.
Probably. Let's see. Where's the answer? Yep, the tibia. The tibia is the second strongest bone in the body, which takes the weight of the leg from the femur and transmits the weight to the foot. Which muscle in the adductor? Please say adductor. Let me hear you say adductor. Which muscle in the adductor group is known as the pelvic floor? Wow, this was a surprise to me last time I saw this, but and we're definitely going to take a look at this. We're going to take a look at all the muscles in that area in a moment. Is the pectineus, the adductor magnus, the adductor longus, or the adductor brevis? Just take a guess. Anybody?
adductor longus.
Okay, it's good guess. It's as good as any. The answer is adductor magnus. The adductor magnus is known as the pelvic floor or the floor of the adductors. It's the deepest of the adductor group. That is like really not well known.
Yeah.
So let's look at adductor magnus and pelvic floor. The adductor magnus has a dual role of being a dynamic stabilizer of the pelvis, meaning it keeps the pelvis from rotating or from anteriorly posteriorly tilting, all that movement that's not intended. Dynamic stabilizer of the pelvis and the femur, as well as a prime mover of the femur into adduction, adduction. Adduction is toward the midline. So everybody, when you see go like this, you're adducting. Here's your midline. I'm adducting my femur right now. Now I'm abducting. I'm sorry, I'm supposed to be saying adducting. I'm adducting my femur using my adductor magnus. I'm abducting my femur using my tensor fascia lata and part of my hamstrings and external rotators. The adductor magnus is similar to the deltoid in that one portion flexes the thigh and works as a medial rotator, another extends the thigh and it's lateral rotator. Okay. Our adductor is connected to the pelvic floor. Adductor magnus. Pelvic floor and adductors are closely related in regards to tension held within them. Pelvic floor tension can affect adductor tension and vice versa. Adductor tension can influence pelvic floor tendon. Okay, so I would say that for the adductor magnus, what is this here? There's the pelvic floor. I would say that for the adductor magnus, that would make the most sense simply because it is the largest, you see?
Mm.
It is the largest of the muscles of the pelvic floor. So, so first let's take a look at the muscles of the adductor. Let's see what we have there. Pectineus, longus, brevis, gracilis. There's no magnus. We have to deduce the magnus. Let's get the magnus like labeled. Okay. So let's get oriented. Here's the ASIS. Here's the ASIS. Okay, here's the ASIS. What's that stand for? Anyone?
Anterior.
Anterior what?
Man, I guess
Superior. What's the name of this bone? Ilium or ischium?
ischium, right?
It's the ischium.
Ilium.
Wait. It's the ilium. Ilium.
Okay.
The ilium. Iliac crest. Anterior superior iliac spine. Spine is a pokey thing. Spine. Okay, so this is the front of the body. If you can tell, the pelvis is actually turned slightly, like 10-15 degrees. And here's the sacrum. Here's the front of the spine. The belly button would be like up here. And then here's the prominence of the femur. I forget what the name of that is. Greater, what is that? The greater trochanter?
The greater choke,
Trochanter.
yeah, the greater trochanter. Yeah.
Okay, thank you very much. The greater trochanter. And then inside the hip, you have the ball of the femur, and you have the socket, and the socket is called the what?
Theremin.
Called the acetabulum, the acetabulum. So
Mm.
everybody say femoroacetabulum. I'm sorry, femoroacetabular joint. Femoroacetabular joint. And if we then look at all these muscles, we're going to get to know all these muscles. Let's leave no stone unturned because it's really not difficult once you just do a little bit of repetition. You have all this craziness in here. Look at all these fibers. Oh my God, how are we going to do this? Well, one by one. Let's start at the spine. What muscle is part of the hip flexor? Right
Psoas.
next to the spine, part of the core, the psoas muscle. That's right. And what fiber do you think this is?
The
It's also part of the psoas.
yeah, like the medial psoas, I guess. I don't know.
Yeah, yeah. I don't know. I don't know if, what the name is, but that would make sense, right?
Yeah.
That would be like the intermediate, and this would be the lateral, and this would be the medial, or something like that, right?
Yeah.
So this is all part of the psoas, and you can see that it's coming down past the ilium, and then this muscle here is the iliacus. It's coming not past the ilium. The ilium is down here. The ilium is up here. The ischium is down here. Ilium, ischium. L comes before S in the alphabet. Ilium, ischium. Okie doke. So the psoas is coming down past the ilium underneath this tendon. What's the name of the tendon? What's this area? What's this area called? What's this area called right here? Not groin.
Pelvis,
Starts with an IL.
ilium.
Alien.
The iliac crest.
The iliac crest is right here. You guys real close. The iliac crest is here. The ilium is up here. Ischium is on the bottom. What's this groove here? The what groove? Don't embarrass me,
The
dog.
the inguinal ligament, is that
Oh,
inguinal?
There you go.
we know.
There
Yeah.
you go. Inguinal ligament. That's right. That's right. It's going under the inguinal ligament, and it's coming down, and it's attaching. Where do the muscles of the hip flexor attach? Onto the femur. Attaches onto the femur. Okay, I'm gonna say this for the recording one time quick, so you can just go through it. If I have time, I'll timestamp it. So the psoas starts at the spine and comes down past the ilium, goes under the inguinal ligament and attaches to the femur. Also part of the hip flexor group is the iliacus muscle. And together, the psoas and the iliacus muscle, they form the iliopsoas muscle. Psoas, iliacus, iliopsoas muscle that attaches to the femur. Part of the, what I would call the hip flexor group. If they say hip flexor on the test, you should think psoas, iliacus, iliopsoas. Don't think rectus femoris, and that's it. Unless that's one of the choices combined with psoas, you are not to answer rectus femoris without psoas or without iliacus or iliopsoas. Okay, so we've got these muscles out of the way. There's one on the side here that's the tensor fascia lata. We'll talk about that another time. But we've got, for the most part, all of these soft tissues out of the way. No longer a mystery, no longer confusing. Raise your hand if it's still unclear.
I mean, it is for me, but only a little bit. Like, it's just a memory thing. It's not what we're teaching. It's just me memorizing.
Let's just do it one more time, right? Same thing that we did with Marcus. So Charday, what are these fibers here?
Already can't remember the name of it.
Okay, that's all right. It's the one that's closest to the spine, and it's obviously part of the, not obviously, but it's part of the core. So which one is next to the spine, part of the core muscles? It's the psoas. Psoas. So the muscles that, how am I going to phrase this to find it? When I think of the core, don't worry, I'm not going to take you guys too far off, and I'm going to give you a break in just a minute. When I think about the core, I think about the front core and I think about the back core. So the back core are the ESG, the erector spinae group. Right, that's the posterior core. The psoas is the anterior core. The erector spinae group, they're like the back bookend group, and the psoas is like the front bookend group. Or you can think of the iliacus, or you can think of the psoas as the left, right, anterior-most bookends, and then the erector spinae group is the left, right, posterior-most bookends. And together, the four of them stabilize the spine, like four columns around the spine, right? So if this water bottle is the spine, you have the psoas on one side, and then behind that, you have the erector spinae group, right? So you have the muscles going like this. This is the right, this is the left, here's the belly button. You turn it this way to the side, you're looking at the patient from the side, you have the psoas in the front, the erector spinae in the back, right? In the middle of my class, my partner wants to know why a piece of cornbread is missing. Because I was hungry and because I made it. So let's finish up here and we will take a break. I think you guys are starting to get a little bit crispy on the surface. So we get the psoas, the iliacus, the psoas. Repeat after me. The psoas. You don't have to unlike psoas and the iliacus muscle to form the iliopsoas, and they attach to the femur. And then the topmost group of the adductors, the topmost muscle of the adductor group would be the pectineus, followed by the adductor brevis, followed by the adductor longus, followed by the adductor magnus, followed by the gracilis. So we're going not just from top to bottom, superior to inferior, we're also going from lateral to medial. Lateral to medial. And you can only go so far medial until you start to wrap around to the back, and then you get to the semimembranosus, semitendinosus, which are also considered part of the adductor group, but not, they're kind of like adductor helpers. Okay, let's see if we can look at this from the medial view. So that's like if we were to slice the body down the center and look at it from inside, and then we will have a break. Oh, this is like kind of crappy. Look at this, like how abstract this is, man. This it really gets on my nerves. Like when they have stuff like this, it just doesn't. Like, how are you supposed to relate to a person who's, you're not going to look at that and then relate to a person who's on your massage table that way. Oh yeah, it looks just like the cross section that I saw from half of the femur upward. Well, if we take all of these and we start to put things together, oh, that's the hamstrings, that's the back of the skeleton. If we take all these things and we start to put them together, we can start to see, let's just look at a couple things from different angles, okay? Here's the psoas muscle, right? They're not showing the three distinct groups of fibers. That's all right. Here's the psoas muscle that comes down and attaches to the femur. The inguinal ligament is missing or cut away. Here's the iliacus muscle, which joins the psoas to form the iliopsoas muscle. This is not one of the adductors. This is so abstract. Okay, and then there is the adductor magnus. Look at how thick it is, right? It does have this little like shark fin cutaway, or this little fin cutaway down here. It attaches to almost the whole femur and attaches to the medial epicondyle of the femur, the distal medial epicondyle of the femur, and attaches to the sit bone. You can see its proximity to the muscles of the pelvic floor might help it to be considered a kind of a pelvic floor adjacent dilio. All right, and then let's look at this one. This one's pretty good. So what's different about the left and right? On the left side, they have this adductor longus, and they have the pectineus, and those are cut away. Here's the pectineus attachment, and it's missing here. Pectineal line. And here's the adductor longus attachment, and it's missing here. Here's the adductor longus attachment, and it's missing here. I don't know attachment versus insertion well enough, but now we can see the adductor brevis, and this must be the adductor magnus. Yeah, adductor magnus, right? This is the magnus. And then on top of that is the longus, and then the pectineus. Whoops. That's the obturator externus. That's in the posterior aspect. Okay, how you guys feeling? You guys, can we take a break?
Yeah.
Okay, great, because we're gonna go a little bit, we're gonna go till like 8:30. Okay, take a 10-minute break and come back at 8:36 my time, 8:36. See you in a little bit.
Yep.
Record that in here. Yeah. Record. It says recording. I think it's word. Here's one. Click. Okay. We're already in the lower body, so let's continue with the lower body for now. All right. Okay, let's look at selling. Okay, we just looked at the medial surface. So let's continue looking at some of the muscles on the medial surface. Let's do, is there a medial one I can just grab? No. Yeah, very nice. Okay, so we were looking at the adductors now. I can't really see them here. Okay, so all right. So over the adductors, you have this long snake-like muscle here. And from its shape, I would like you to remember that it turns the knee out as it pulls the knee up. So it's it's the gracilis muscle. That's also called the Taylor's muscle, pulling the knee up, so flexing at the hip and turning the knee out. It's actually a similar movement that the psoas does, just not quite with that sort of range. So this muscle is called the gracilis muscle. Gracilis muscle. Taylor's muscle. The greater trochanter. Here's the patella. Here's the patella. Gracilis is the snaky one. The sartorius. Did I say gracilis? I'm sorry. The sartorius. Yeah, the sartorius is the snaky one, the Taylor's muscle. The one that is more straight and also much more thin, if you palpate it, you'll feel it, is the gracilis muscle. You can feel the gracilis muscle by squeezing your knees together and going just slightly posterior. So it's the medial posterior aspect, and you can feel it kind of in front of the hamstrings. Don't have the time to really stretch out with the palpation, and the gracilis is definitely one that's a little bit harder to feel. And then right behind that are the hamstring muscles. And the hamstring muscles, we'll look at these specifically. The hamstring muscles and the gracilis, they form the pes anserinus, a structure known as the pes anserinus, the foot of the goose foot, that inserts onto the medial tibia. Your clients will say, I'm having knee pain. I'm having knee pain, but it's right here. It's on like right on the bone. If I press it, I can feel it. And there's probably a bursa underneath those tendons. The tendons and the bursa get inflamed. And if you treat these medial hamstrings and the gracilis and anything else in proximity that you find tight, gently so that you loosen them, it'll start to relieve some of the pull. They'll think you're a genius. Okay, and then you have the muscles that attach and act on the patella and the knee, the vastus medialis, and then on the top is the rectus femoris. We'll look at those along with the 4 muscles of the thigh in a moment. In the back, you have the gastrocnemius, what we think of as the calf muscle, and underneath you have the soleus muscle. Well, and you can see it over here from the lateral view, medial view, lateral view, medial view. You have the soleus muscle. And then you have a few other muscles behind the tibia. I always forget the order. We'll look at them. And then the tibialis anterior on the front of the tibia. On the other side of the leg, you have the vastus medialis and the rectus femoris. Here's the rectus femoris. On the other side of that is the vastus lateralis. You keep going laterally. Now you have the iliotibial tract or the IT band. And then behind that, you have the hamstrings. The first one is the biceps femoris. The first one on this diagram is the biceps femoris. The most lateral one is the biceps femoris. And let's get into some of the specific muscles that are going to be a little tricky. Or, I mean, I don't know if they're going to be tricky for you. They are for me, and they are for most people. This is a good one. I like this one. It's clear, simple. Okay, so the biceps femoris muscle, biceps means to, by, right? What does sep mean? Seps, biceps. Biceps comes from the Latin word bis, meaning double, and caput, meaning head. Caput. The combination form of caput is seps. All right, so anyway, biceps femoris muscle. Somebody says biceps and you're thinking the arm, right? And how are you to distinguish between the arm and the leg? Because of the name, biceps femoris versus biceps brachialis. I mean, it's the humerus bone, but it's the brachialis. Why is it named the brachialis? I'll look at that later, I'm sorry. Biceps femoris muscle on the lateral side. And then the semimembranosus, semitendinosus. How are you going to remember the semimembranosus is in front and the semitendinosus in the back is in the back? How are you going to remember that? Because one looks like a membrane and the other looks like a tendon? No, sorry, my friends. Well, how about the letters? M for membranosus, T for tendinosus, M that comes before T in the alphabet. Membranosus is more in front. Tendinosus is more in back. If looking from front to the back, it's the membranosus, then the tendinosus, front to back. You got to have some kind of a method. I'm just checking to make sure that my kid is not getting black bean soup with cheese all over my laptop. Sorry. So semimembranosus in front and semitendinosus in back T. And together you'll notice that they form this attachment at the, what bone is this? So here's the femur, right? That's the long one. Touch your femur now on your thigh or on the back of your thigh, right? And then below the femur, there are two bones, two long bones, and they are, one is
The
the
tibia.
second strongest bone in the body, the tibia. Oh yeah, it's labeled right here, tibia. All right, so anyway, it attaches to the medial or lateral aspect of the tibia, right here, semimembranosus tendinosus. Which one? Medial or lateral aspect?
Medial.
Medial aspect, that's right,
Yeah,
that's
medial.
right. And it forms the pes and serenus, pes and serenus. Pes and serenus, yeah, not a bad. Oh wow, look at this, like the traditional drawings are like, so they show them with stuff that's like cut away and so abstract. Okay, so the pes and serenus is formed by the muscles of semitendinosus. I guess semimembranosus is technically not one of those. Huh. So the semitendinosus, the gracilis muscle tendon and the sartorius muscle tendon form the anserinae bursa, form the pes and serenus, pes and serenus. It's kind of like a duck leg, right? Or a duck's foot, like a flipper foot. Looks kind of like that. Like the flipper foot's down here and his ankle would be, his or her ankle would be up here. Okay. Look, here's a bursa under the pes and serenus. The bursa under the pes and serenus. See, is there anything else interesting I can show you? Let's look at the attachment for the semimembranosus. Origin, insertion. Let's see, this is the posterior aspect. Yeah. Yeah. How do I know that this is the, how do we know this is the posterior aspect of the body? Look at the sacrum and look at the knee. How do we know this is the posterior aspect?
The way that
Um,
it's facing. Go ahead.
Yeah, I was. Oh no, I was gonna say at the tailbone and like
Yes.
yeah, at the very bottom, and then that's the soleus, right?
No, the soleus is below the knee.
Below the knee. Okay, yeah,
joint.
below the knee.
But look at this. How do you know this is the back and not the front of the knee joint?
Because of it's like an insertion there type. It kind of looks like it looks open.
I mean, this looks open right here.
Yeah, yeah.
There's no, because there's no patella. Because there's no patella. That's
Right, no patella.
Okay.
Yeah.
So it looks like the semimembranosus inserts a little bit more posterior and a little bit higher up than the pes and serenus. A little bit higher up and a little bit more posterior than the semitendinosus. Believe me, it pays to get like this specific about stuff, because once you see it up close in higher detail, it's just easier to remember. So semimembranosus, 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 semitendinosus, yeah. Here's comparison. This is pretty good. And this is like, oh my God, Pinterest. I hate Pinterest. I hate Pinterest. Okay, so we have the, okay, which one is this, Josh? We have one with a thick tendon that comes down and inserts to the back of the tibia. And we have one with a thin tendon that comes down And I hope you can see this, Josh. It inserts more onto the neck of the tibia. Neck of the
Absolutely
tibia
no
versus-
idea.
Okay, okay, so the pes anserinus is made up of pes anserinus is made up of the tendons of 3 muscles. And that is, yeah, I'm sorry. Pes anserinus is made up of, I did it again. He's like, what's the matter? Yeah. I must have left my Geritol in the car or something. Okay, can you guys see this clearly enough?
Yeah.
Okay,
It is semi-tendinous.
yes. So here's the STT semitendinosus tendon, semitendinosus, which crosses the knee joint and comes to the anterior aspect of the tibia. And then the gracilis tendon, gracilis muscle, gracilis tendon, and the sartorius tendon, sartorius muscle, sartorius tendon. And then the compare that to the semimembranosus, right? Compare that to the semimembranosus. So here's the semitendinosus crossing the knee joint, and it's wrapping around. It's a little hard to see. It's wrapping around to the anterior portion of the tibia. And here's the semimembranosus wrapping around to the anterior portion of the knee. Here's the semitendinosus inserting at the back of the femur. Tendinosus, I reversed it. The semitendinosus attaches to the front. The semimembranosus attaches to the back. The semimembranosus is more anterior because M comes before T. Semitendinosus is more posterior, but their tendons switch. Their tendons switch. Tendinosus goes to the front, membranosus attaches to the back. Let's see if we can find a clearer semimembranosus, tendinosus, tendons. Doesn't matter. Google doesn't care. Google's good. No, not quite clear enough. No, not quite clear enough. No, no, close, but no. No, I'm not seeing anything that's no. This nonsense. This is how people used to learn. Good one. Okay. Here we have the the vastus medialis, rectus femoris. Oh, this must be the gracilis. I see. No, it's not showing it. Okay, this tendon is attaching to the posterior aspect of the femur, and in these tendons, it's not showing in these tendons on the anterior aspect. There's also an attachment of one of the hamstrings. The one that's attaching anterior, is it the semimembranosus or the semitendinosus? Larissa. I should have given you a heads up. The one that's attaching to that anterior aspect of the femur, Larissa, is that the semimembranosus or the semitendinosus?
Semitendinosus.
That's right. That's right. And how do you know?
That was, I don't know.
Because okay, because membranosus comes before tendinosis, letter M and letter T in the alphabet. Letter M, this one is more anterior. And letter T, this one is more posterior, the muscle bellies. The muscle bellies. But for the tendons, the membranosus, they switch. Membranosus is more posterior. The tendinosus is more anterior. The membranosus is more posterior tendon. The tendinosus is more anterior. This is the anterior portion. This is the posterior tendon. The posterior tendon, Josh, the posterior tendon is which one, membranosus or tendinosus? The posterior tendon is which one, membranosus or tendinosus?
The posterior membranosus.
Yes, and the muscle belly, is it the membranosus or the tendinosus that's anterior?
The muscle belly and no, tendon and membranosus.
Membranosus, that's right. Which one comes first in the alphabet? Just humor me so I can see.
Membranosus.
M for membranosus. M for membranosus. Which muscle belly is in front? Membranosus or tendinosus?
Membranosus.
Which muscle belly is more in back?
Tendinosus is
That's right.
posterior.
What happens to the tendons of membranosus and tendinosus?
They change position.
They switch. That's right. They switch.
They wrap,
Good.
I guess.
So, yes.
I did find it.
Yes.
I did find that if you look up semitendinosus, there's some really good pictures. So
Semitendinosus. Okay. Okay.
semitendinosus anatomy. There's some good pictures with good labels.
Okay.
least I found some.
I'm not seeing anything that really speaks to me more than the others, but yeah, good on you for looking. So is this the posterior or the anterior aspect of the body? A 50-50 shot.
Oh, I'm sorry, posterior?
That's correct. How do you know?
No patella.
No patella, that's right. Also, look at these bones, look at the shapes of them.
Oh, right, yeah. Yeah, the tibia is on the medial side.
Yes, the tibia is on the medial side for both, but it would be on the medial side if you were looking at it from the front, from the front too. But if you look at the tibia from the front, here's a good one. If you look at the tibia from the front, you will notice that it has an edge. There's an edge to it, which is why when somebody kicks you with their shin, or when you block a kick with your shin, somebody pays for it. And in the back, it's much more flat, right? Also, if you look at the fibula, you can barely see all of the fibula here. if you look at the fibula, in the front, there's kind of a sharp part, right? And there's like the sharpness goes all the way up. And in the back, it's more flat. The neck is more flat. Right? It's the shin bone is very sharp in the front. You can even see it in this drawing a little bit. See that line? It's like the sharp edge. And that is absent in the posterior aspect. So would you say that this tendon, Josh, is more anterior or more posterior on the femur?
Well, it looks like it it looks like it attaches on the anterior part of
I
the
would agree
tibia.
with you.
Yeah.
I would agree with you. Yeah, yeah. And which muscle attaches to the anterior aspect of the femur? The semimembranosus or the semitendinosus?
Tendinosus,
That's right. And how do you know it's the tendinosus?
because it starts with T and it wraps around. So
That's right. It starts with T. T is the more posterior of the two muscle bellies,
right,
and their tendons switch places.
they switch places.
Yeah, very good. Let's look at some of the other messed up stuff around the muscles of the hip. Muscles of hip. Okay, muscles of the hip. Muscles of the hip. Oh, lousy. Okay. Muscles of the hip. Ooh, wee, man, look at that. Looks like a transformer or something. That's huge. All right, what a mess. This too, the deeper layers, very mysterious. Okay, we just saw this a little while ago. We saw the psoas, the iliacus. Down here is the iliopsoas, which is obscured by part of this sartorius muscle. Notice the sartorius follows, for the upper part, follows the trajectory of the inguinal ligament. And then you have, they're labeled here. I definitely would not be able to look at these and go, yeah, gracilis adductor longus pectineus. I definitely would not be able to do that. But I do remember that the pectineus is the highest and most lateral one. So I might be able to figure out at least that one, but I don't think I have any other gracilis. So the pectineus, adductor longus, gracilis, deep to those is the adductor magnus. It'd be behind this vastus medialis or VNO. Then there's the vastus lateralis on the other side. And the rectus femoris. There's a shallow and there's a superficial and a deep rectus. And then there's the tensor fascia lata, one of my favorite muscles. Tensor fascia lata, which externally rotates and also abducts and flexes the hip. So I love this muscle because it does so much, and it's small. It's like your pocket muscle, right? And don't embarrass me. And so there's a little abduction happening, but there's external rotation, as well as internal rotation, but external rotation and hip flexion. You can really feel it firing when you do that. But you can also feel it firing if you bring your knees together with one knee flexed, one hip flexed. This is straight, this is flexed. And you squeeze your knees together, you can also feel it there. It's a busy little muscle. It has two trigger points, which we'll look at in a little bit. Tensor fascia lata, they've drawn it very big. It's not really that big. And then if we look around to the back, to the side and the back, we find the muscles of what I think of as the true hip. Let's start here. Okay. Rectus femoris, vastus lateralis. Look how big the vastus lateralis is, right? Big one. And then there's, oops. And then there's the IT band, iliotibial tract, IT band. And then in front of that, or attaching to that actually is the TFL, tensor fascia lata. Tensor fascia lata. This is probably the rectus femoris or maybe the sartorius. Here's the rectus femoris muscle labeled, vastus lateralis, IT band, tensor fascia. And then there's the gluteus medius. Look at the directional fibers of the tensor fascia. You can tell that as they start to shorten, there would be some abduction, right? Some, don't steal the show, some abduction, but there's also some external rotation and internal rotation. It's one of those muscles like the glutes that has, I believe, fibers in the upper part that rotate inward, fibers in the lower part that rotate outward, or maybe it's the anterior portion rotates inward, the posterior rotates outward, something like that. But it's a major one. Hip pain, hip flexor pain, sciatic pain, SI joint pain, always check your TFL. Always check the TFL and the IT band. And gluteus medius, which is right there. And then the glute max on the surface. And deep to the glute max, oh yeah, biceps femoris. In front of the biceps femoris is the vastus lateralis, glute max. And then under the glute max are some of my favorite muscles. So here is the glute max. Here's the gluteus medius, right? It's actually not concave like that. It more like wraps. I don't have one. It's more like this. It's more full than they're showing it there. Maybe just use this one. It's more full than they were showing it in the other one. See how plump that looks right up here where the tendinous portion becomes muscular? It's a lot more like that. And it also has fibers that twist a little bit back toward the trochanter. And then underneath that are the lateral rotators. Those are the ones that spin the leg outward, spin the knee outward, knee out, toe out. That, I hope you guys can see that. Right? That is the piriformis muscle, followed by the, I don't know, obturator externus, gemellus obturator internus. We'll get all those down in just a minute. I always forget all those because it's like it's so much information. Okay, is this clear enough or should I find another one? Clear enough? We'll look at this one and another one. So, okay, gluteus minimus, glute min, right under that is the piriformis muscle. Right under that is the superior gemellus, Under that is the obturator internus, under that is the inferior gemellus. And then the quadratus femoris is attaching. Why is that there? Let me find one or two others so we can compare. Because as you can see, some of the concepts, some of the drawings are a little bit different. Oh boy, here's it's like old style stuff is often confusing. This is pretty good though. I like the arrows, it shows which way the fibers are going to be pulling. And that really tells you that this greater trochanter out here will be spinning externally, I should just say. Okay, gluteus minimus, piriformis below that, superior gemellus superior, the gemellus on top, gemellus inferior, and then there's one between them. That's the obturator externus, quadratus femoris, that's the obturator internus. Gemellus superior, obturator internus, gemellus inferior, obturator externus. Okay, how are we going to remember these? The gemellus and the obturators, they come in pairs. It's the gemellus first, and then the obturator. Again, it's alphabet. Again, we see something alphabetical, right? So now you just got to figure out how you're going to match, how you're going to couple in your mind superior with internus, inferior with externus. You could make up kind of a rationale or a story. So the superior way is always looking inward. It's always the internal work that a person does that is superior. Whereas the external, the muscles and the looking outward, the external way is vastly inferior. You could do something like that. Or maybe you could do the letters SI followed by IE, SIIE. Maybe that'll make some sense to you somehow. You could make something up like silly internal infernos exist, or something of that nature, or whatever. Yeah, okay, I'm gonna stop there with that nonsense. Okay, what nerve, I'm gonna put my cursor over so you can't see it. What nerve passes underneath the piriformis? It's an important one.
The sciatic nerve.
The sciatic nerve, that's right, the sciatic nerve. Okay, let's take a look at, can we keep going with muscles, or you guys want to look at like some trigger points and stuff? Can we keep going with muscles? Give me a thumbs up if yes.
I like it.
Okay.
I honestly like everything. Like I like exercising the muscles. The questions are very helpful.
I just want to make sure that you guys aren't fried.
Right.
And this
No,
is the
no,
last
not at
thing-
all.
thing
Actually,
we
it's
gotta do.
like, yeah, it's like I'm getting more into it.
Great, awesome,
Yeah.
awesome. Okay, so then now let's cover the muscles of the posterior compartment of the lower leg. And this is a lot of people find this intimidating, but it's really not. Doesn't have to be. I like the colors. This is good. Okay, oh, this is a deeper layer. Here's the more shallow layer. I wonder if there's one more. There should be one more because they've cut away the gastroc muscles. Maybe if I go to the website, it'll have everything. Muscles, posterior compartment, leg. Okay, I accept, go away. Oh, I see. You want to continue reading? You got to pay. Hey, not like I'm using this in the classroom or something. Who gives? So let's see. Okay, so you guys just gonna have to imagine the heads of the gastroc muscles, right? Now, these are the ones that we really think of as the calf muscles. They look like two big, I think of them as like bullfrogs, two big bullfrogs, like under the skin. And the gastrocs form part of the calcaneal tendon or the Achilles tendon. So does the soleus. The soleus is a big, flat, wide muscle. It is a plantar flexor. Everybody pick your foot up off the floor and do plantar flexion and feel your soleus muscle moving. If you want to feel the soleus and feel it really well, let me make sure that you guys can see this. If you want to feel the soleus and feel it really well, palpate the side of your posterior aspect, right? So on the inside, this is the inside of the foot, medial malleolus. On the inside of the foot, you just go along the back of the tibia, and then dorsiflex plantar flex your foot, and you'll feel those muscles contracting. And right behind that are the gastroc muscles. In front of the gastroc muscle, behind the tibia, is the soleus muscle, and you just go right through and palpate the other side. You'll also feel the soleus on the other side. It goes all the way down. Very, very, very strong muscle. It is analogous to the brachialis muscle in the arm, which we'll look at in a moment. Okay, and then if we go deeper than the soleus, we then find the popliteus. Remember that tripped one of us up earlier? Here's the popliteus muscle. That refers quite a lot of pain, quite a lot of posterior knee area pain. And then there's the tibialis posterior, the flexor digitorum longus, flexor hallucis longus. So, so how to remember these? All right. Well, first of all, I think if you count the 1, 2, 3 muscles of the if you count the 2 heads of the gastrocnemius muscle and plus the soleus plantaris, that's 4, that's 5, 6, 7, 8. There's 8 or 9 muscles just in the back of the lower leg alone. 8 or 9 muscles. That's a lot. So, you know, let yourself get it wrong once in a while. But I like to remember that the flexor hallucis longus, to me, it looks like it sits on the external or the lateral portion of the tibia up here, and then it crosses. And I know this muscle FHL because there's a very a common injury among dancers. So when they point their feet, when they go on point, this muscle contracts, and you can see it's not as thick, it's not as strong as the soleus and the gastroc. So it tends to get overworked, and the tendon that crosses, you could say the midline of the tibia, wraps around the back of the foot. It inserts underneath the big toe. So I remember it that way. Flexor. I cannot spell, but I can pick it out of a multiple choice. Flexor hallucis longus tendon goes. It's a little hard to discern. Flexor hallucis longus comes from the back, right here, from the back of the compartment behind the tibia, and then wraps underneath the medial malleolus and goes under the foot. Here's under the foot. This is the heel. This is the bottom of the big toe. Goes under the foot along the big toe. FHL tendonitis. Okay, and then flexor digitorum longus. Flexor digitorum longus is on the inside. Flexor hallucis longus. Hallux, big toe is the hallux. The others are digits. Big toe alone is called the hallux. Tibialis posterior is right behind the tibia. Right behind the tibia. Popliteus is above it. I love the colors. Awesome. Okay, what did I say we were going to look at? Let's finish by looking at, so you have seen it. So the peroneal muscles, if you have Trail Guide to the Body or Janet Travell's book, these are drawn very well in there in a way that's not, for me, at least too abstract. How come they don't have all 3 listed in one drawing? This is like what I'm talking about. This is a little abstract over here. This one's not bad. All right. So you have the head of the fibula. Usually I'd ask you guys, but we're running out of time. This is the head of the fibula. And then you can see that this muscle belly starts way up there at the head of the fibula, and then becomes tendinous about halfway down. Right where it becomes tendinous, there's another muscle belly underneath it. And this is, we're calling that the peroneus brevis tendon. I thought the brevis was over here. Let me look at a couple more. There's 3 peroneal muscles. Sorry, that looks like the 3 peroneals drawn there, but it's not. They're definitely going to ask you about this for sure. Oh, I see. I've got my terminology incorrect. I need to clarify my terminology. So it's longus, brevis, and then tertius. So it's the long one, the short one, and then the third one. Of course, that's what I always like. I always, when I see like a family with 3 kids, I'm like, hey, it's big, little, and number 3. Makes perfect sense. So you have the longus, and then under that, you have the brevis, right? And then in front of that, you have the third one, the fibularis tertius or the peroneus tertius. Let's go back to that previous drawing. Yeah, I still don't like this one very much, but I see. So they have 2 copies of the same muscle, the peroneus longus, and then they have the peroneus brevis. They're just not showing the tertius, which is here. I thought that was the tertius, but that was the brevis, but it's not. It's the tertius. Longus, brevis, and then tertius. Okay, and then one more. I just want you to see that the brachialis muscle in the arm is a nice analog to the soleus muscle. So here we go. So you have the biceps, that's like the calf muscle, right? And then you have the brachialis under that, that's like the soleus muscle. Go down here. Here's the brachialis muscle, and then down along the forearm is the brachioradialis muscle, from the brachius to the radius. And above this, on top of that, would be the biceps brachii. Biceps brachii, brachialis, brachioradialis. Okay, guys, be on the lookout for some links, and if you have any feedback for how tonight went, other than hey, Kim, try not to be 30 minutes late. If you have anything else, like, please pass that along, because I'm looking to make this this better. If anything's not working for you, if you have any criticism, please pass that along too by text message. I don't do too well by email. Thank you for your time, everybody. Have a great night, and we'll be in touch. We'll see you on Wednesday at 6 o'clock, not 6:15, 6 o'clock, regular time Wednesday, 6 o'clock. Okay. If you can, study the heart and skin for next time. I'll just go over those. All right, take it easy, guys.